Thank you. So today I'm going to talk about some of the things that we think can have an impact on individuals' finances after a cancer diagnosis. But I want to start by telling you a little bit about the resources that we have available at Triage Cancer on these topics so you know where to go for more information. So if you aren't familiar, Triage Cancer is a national nonprofit organization that provides free education on all of the legal and practical issues that come up as a result of a cancer diagnosis. And many of those things aren't necessarily things that you would think of as legal issues, like navigating health insurance, but that there are protections and benefits that exist that are rooted in the law, and therefore they are legal issues. And so we provide that free education through our educational events, including our webinar series, where we provide free education on topics across the spectrum. So things like understanding disability insurance or Medicare. We have one coming up in December on food and fitness. So the webinar series is broad. And if you can't attend a live webinar, you can watch the recorded webinars on our website. We also have free educational materials on a variety of topics, including some of the things I'm going to talk about today. And they exist in shorter versions, like our quick guides and checklists, but we also have worksheets and spreadsheets to help you manage these legal issues. And then we also have our practical guides to cancer rights. And these are longer guides that cover some of the topics we think are most important for people to be aware of, including work, insurance, and finances. And we have our main guide, and then we have guides specific to young adults and seniors, and then one specific to caregivers. On our website, we sort information by topic as well as by location. So if you wanted to find all of our resources related to health insurance, you could visit our health insurance topics page to see all of that in one place. We also have a tool called Cancer Finances, where it covers information that can impact your financial situation and guide you to the information that's applicable to you by asking you questions. So you answer those questions based on your situation or what you're looking for, and then it tailors the answers based on how you've answered those questions. So you really do get directed to the information that's most relevant to you. We also know that not everybody learns in the same way, and maybe people won't want to read about this information, and that sometimes it's not the most exciting information to learn about. So we do have our animated video series, which are all about 5 minutes long and describe some of the things, again, that we think are most important for people to know, like how to pick a health insurance plan or take time off work and pay for it, or even manage medical bills. And then we do offer a free legal and financial navigation program where people can contact us for one-on-one assistance with any of the issues that they might be having related to insurance or work or finances or even estate planning. And you can fill out a form on our website to talk to us individually. Now, when we're talking about financial toxicity, this is a term that's a relatively new term. It was coined by some researchers in 2013 at Duke, and it really described the financial burden that a cancer diagnosis could have. And we actually think part of the challenge in solving financial toxicity is that there's lots of contributors to it. It isn't just one source of financial burden, like the cost of care. There are lots of things that contribute to financial toxicity. And we think that the number one way to actually avoid financial toxicity is by having adequate health insurance coverage and then understanding how to use that coverage effectively to lower your costs. But there are other things that contribute to it as well, like understanding your employment rights and your ability to take time off work and maybe access disability insurance to replace lost wages. But there are also things that happen in life that can have an impact on our financial situation. And so those things continue to happen even when there's a cancer diagnosis. So understanding how all of these things contribute to financial toxicity is key to trying to avoid some of that financial burden. Now, I mentioned that we think the number one way to avoid financial toxicity is by having adequate health insurance coverage. But as consumers, that sounds easier said than done. And part of the reason why is that in the United States, most people don't understand health insurance coverage. And that used to just sort of be my anecdotal experience based on the work that I do. But now I have data to back it up. 96% of all Americans can't define the 4 key terms used in health insurance coverage. So how are we expected to be good consumers of health insurance if we don't even understand the words that are being used? And that certainly contributes to the fact that only 40% of Americans feel like they're very confident that they can choose the right health insurance plan for them. And so if you feel like you don't understand health insurance coverage, you are absolutely not alone. So I want to start by talking about some of those very important terms to understand. Now, there are costs that we pay to have health insurance, and those are typically referred to as our premium. It's what we pay, usually each month, to have health insurance. So even if we never got medical care during the year, we'd still have to pay our monthly premium just to have the insurance. But then there are costs that we pay when we actually use our health insurance and get medical care. And the first is our annual deductible. So that's a fixed dollar amount that we have to pay first for our medical expenses before our health insurance coverage even kicks in. And we pay that each year. So it's our annual deductible. You might have a $500 deductible, or you could have a $5,000 deductible, depending on the plan that you have. And then there's something called a copayment. And this is also a fixed dollar amount that you pay when you get certain types of care. So you might have a $30 copayment to visit your primary care physician, or you might have a $50 copayment to see a specialist, or you could have a $250 copayment if you have to go to the emergency room. Again, the amounts are going to depend on your plan. And then there's something called coinsurance or cost share. And these are 2 terms that do mean the same thing. And it's the difference between what insurance companies pay for our medical expenses and what we pay. So if you have an 80-20 cost share, the insurance is going to pay 80% of your expenses and you're responsible for 20%. And then probably the most important thing that everybody should know about their health insurance coverage is their out-of-pocket maximum. That's the most that you're going to pay out of your own pocket for your medical expenses during the year. So depending on the plan that you have, you could have a $1,000 out-of-pocket maximum, or you could have a $20,000 out-of-pocket maximum. The fixed dollar amount for your out-of-pocket maximum is going to depend on the plan that you have. And the way that you reach your out-of-pocket maximum is that you get to add up what you pay for your deductible, plus any co-payments that you make during the year, plus any co-insurance amounts that you make during the year that help you reach your out-of-pocket maximum. And when you do, then your insurance will kick in at 100% for the rest of the year. So to give you an example of how this works, Dan has a plan that has a $2,000 deductible. It's an 80-20 plan, and he has an $8,000 out-of-pocket maximum. So Dan has spent a week in the hospital, and he walks out with a $102,000 hospital bill. So assuming he's had no other medical expenses during the year, what does Dan actually have to pay of that $102,000 hospital bill? So first, he's going to pay his $2,000 deductible, which leaves $100,000 left of that bill. And then he has an 80-20 plan, so the insurance is going to pay 80%, and he's responsible for 20%, which is $20,000. But how much of that $20,000 bill does he actually have to pay? Well, he already has spent $2,000 for his deductible. and he has an $8,000 out-of-pocket maximum. So he only needs to pay another $6,000 of that $20,000 bill, and then he'll reach his out-of-pocket maximum. So his insurance will kick in and pick up the rest of that $20,000 bill. Now, what I just described is actually in one of our animated videos on health insurance basics. But there are some details that are important to understand about out-of-pocket maximums. So the first is that you might have a family plan where you're covering your whole family. And that means in your plan, you could have an individual out-of-pocket maximum as well as a family out-of-pocket maximum. And then for plans that are sold through the marketplace, the out-of-pocket maximum is required to include the deductible, the co-payments, and the co-insurance amounts, both for medical care that you receive and your prescription drugs. So it's the most protective for consumers. But some employer plans may carve some things out of the out-of-pocket maximum. So some employer plans don't include deductibles, where the out-of-pocket maximum is only going to include the co-payments and the co-insurance amounts that you pay. Excuse me. And then some employer plans don't include the deductibles or the co-payments, and it's only going to cover the co-insurance amounts that you pay. And then some employer plans don't include prescription drugs. So they have a separate out-of-pocket maximum for prescription drugs. Now, if your plan actually does cover out-of-network services, maybe at a lower rate, it might also have a separate out-of-pocket maximum for out-of-network services. So the details matter in terms of the type of plan that you have and what gets included in the out-of-pocket maximum. Now, there are some very important consumer protections that exist in the Affordable Care Act that I want to mention. And the first is that it changed the way that insurance companies decide how much to charge us for our premiums. Prior to the Affordable Care Act, insurance companies could decide whatever they wanted to when charging us for our health insurance premiums. And now they can only charge 4 things: whether or not you're buying a policy for an individual or a family, because if you're covering more people, they can charge you more; where you live based on your zip code; your age, but they put a cap on how much more you can get charged as you get older. And then if you use tobacco products, you can also be charged more for your health insurance coverage. So what's missing from this list? Pre-existing conditions and gender. Women have always been charged more than men for health insurance coverage, and that's no longer allowed under the Affordable Care Act. And then the ACA went a step further and said, we're not going to let insurance plans deny you coverage based on your age, your gender, your pre-existing condition, or really anything else. If you can afford the plan, they have to provide it to you. So these 2 things together actually mean that someone with a cancer diagnosis can't be denied health insurance coverage and can't be charged more because of it. But this second part of the protection isn't really a protection unless it comes with the first part, because it's not really a protection to say an insurance company has to sell you the plan if they can charge whatever they want for it. So the premium rating protection limits what an insurance company can charge for that plan. And so these 2 things together are really what creates the pre-existing condition protection in the ACA. Now, in the United States, we only get our health insurance coverage from 3 places. We're either getting it directly from an insurance company, we're getting it through the government, and by that I mean Medicare or Medicaid, military or veterans plans, state or local programs, but still about 50% of people in the United States get their health insurance coverage through an employer. Now, I want to talk for a minute about some different types of health insurance coverage and some key things to understand about making choices related to those options. Right now, we are in the Medicare open enrollment period where people who are on Medicare can make changes to their coverage. Now, Medicare coverage actually can be chosen in two different ways. So there's two different lanes that you can drive down when making Medicare choices. And the first is called Original Medicare, where you're getting your coverage through Part A and Part B. And then you can also pick up prescription drug coverage by buying a Part D prescription drug plan from a private insurance company. And then because Part B is one of those 80-20 plans, and you're responsible for paying 20% of your expenses all year long without an out-of-pocket maximum or a cap on those expenses, you may also want to pick up supplemental coverage. And supplemental Medicare plans are called Medigap plans. So you can then decide if you want to buy a Medigap plan, again, from a private insurance company. So that's lane one. Lane two is when you decide that you would prefer a Medicare Advantage plan, which is a Medicare HMO or a PPO, which gives you the benefits under Part A and Part B of Medicare. And then 90% of Medicare Advantage plans also include prescription drug coverage. But if you happen to pick one of the plans that doesn't, then you might also want to pick a Part D plan. But that's where lane two ends. You can't have a Medigap plan with a Medicare Advantage plan. And the reason why is because it has an out-of-pocket maximum. Now, the out-of-pocket maximum for this year for Medicare is $7,500. Now, I want to talk for just a minute about Part D's prescription drug benefits. So Part D I just want to make sure that you all can hear me.
I can hear you now.
Great. So I apologize for the technical difficulties. So Part D of prescription drug coverage is the part of Medicare that actually covers prescription drugs. And the way that a standard Part D plan works is very specific. The Affordable Care Act actually made some changes to Part D and closed what we call the Part D donut hole. So this is what it looks like after the Affordable Care Act in 2022. So this year, you have an $480 drug deductible that you have to pay first before your Medicare kicks in. And then you enter what's called the initial coverage phase, where Medicare pays 75% and you're responsible for 25% of your drug expenses. And then you reach the total out-of-pocket drug costs of $7,050 for the year, which moves you into the catastrophic coverage phase, where Medicare pays 95% of your drug costs and you pay 5% of your drug costs. So this is how a standard Part D plan works. And that actually can pose a lot of challenges, because if you have a drug that's very expensive, you're paying 5% of that cost for the remainder of the year. So there isn't a true cap on drug costs under the under Medicare Part D. So the Inflation Reduction Act, which just passed a few months ago, actually made some changes to Part D. In 2024, it actually eliminates that 5% catastrophic coverage payment. So there will be a cap on what you pay for your prescription drugs during the year. We just don't know what that's going to be yet because we don't know the amount of your total out-of-pocket costs that are going to kick you into catastrophic coverage for 2024. For 2023, that's going to be about $7,400 in total out-of-pocket drug costs. And then in 2025, there will be a total cap on out-of-pocket drug costs at $2,000. So that's a significant drop in total drug costs out of pocket for the year. And that's actually very exciting because it's something that the cancer advocacy community has been working on for a very long time. Now, in 2025, the Part D plans will also allow for smoothed out cost sharing or cost smoothing. And this is because a lot of times your out-of-pocket drug costs might all occur in January, at the beginning of the year, because of the cost of your drugs. This allows you to actually spread out that cost for the remainder of the year, so you don't have to pay it all up front in January, which again makes it a lot easier for someone to actually pay those costs and address some of those financial challenges. Now, I mentioned that right now we're in open enrollment for Medicare, so this is your opportunity to make changes to your coverage and drive back and forth between those two lanes. And so every single year, you should actually be reviewing your coverage to make sure it works best for you. And at Triage Cancer, we have a lot of resources to help you understand Medicare and how to pick the best plan for you, including a worksheet to help you do the math on your out-of-pocket expenses. Now, Medicaid is the other federal health insurance program that is only available to individuals with a low income. And prior to January 1st of 2014, you also had to have a low resource level and meet some other category of eligibility. So there were these different doors into the Medicaid program. Most of the time, someone in the cancer community could only get access through the door on the left, which is where you go to the Social Security Administration, apply for supplemental security income, and then get access to Medicaid, which actually was a lot of hoops to jump through if you were trying to get care through Medicaid. The Affordable Care Act created a new door into the Medicaid program for anyone with a household income up to 138% of the federal poverty level, which this year is $18,754 for an individual. Now, the Affordable Care Act required every state to create this new door, but the Supreme Court made it voluntary for states to participate. So this is what it looks like as of today. The states on the left have chosen to expand access to their programs, and the states on the right have chosen not to. And the states on the right represent about 4 to 5 million people who would have gotten access to coverage, but haven't because their states haven't expanded yet. Now, the Affordable Care Act also created the state health insurance marketplaces, and these are effectively insurance shopping malls. It's one place that you can go to find all of your private insurance options and to see if you qualify for Medicaid in your state. But there are some actual benefits to buying health insurance coverage through the marketplace. And the first is that there are those consumer protections that exist, but also that there's a cap on the out-of-pocket maximum for all the plans sold through the marketplace. So this year, that cap is $8,700 for an individual, meaning that you are not allowed to sell a plan in the marketplace with an out-of-pocket maximum higher than that. So there are also financial assistance options available for buying a plan in the marketplace based on your income level. And there are two types. There are premium tax credits, which lower what you pay for your monthly premium. And then there are cost sharing subsidies, which lower what you pay for your out-of-pocket costs. Now, there's a lot of confusion about the marketplaces, and many people think that it's actually buying health insurance from the government. But the government just created the shopping mall for private insurance companies to come and sell their private insurance policies to people. The other benefit to the marketplace plans is that they're all standardized so that you can actually compare apples to apples and oranges to oranges. And the way that they're standardized is by their cost share. So a platinum level plan has the highest level of coverage at a 90-10 plan, down to a bronze plan, which is a 60-40 plan. There are also plans called catastrophic plans, which are only available to young adults, but they're not full scope health insurance plans. So generally, if someone has access to another option, that option would be better because it'd be a full scope health insurance plan. Now, if you're in a state that expanded Medicaid, this is what it looks like based on income level. So if you have a household income up to 138% of the federal poverty level, you can get access to Medicaid. If you're between 138 and 250% of the federal poverty level, you have access both to the cost sharing subsidies and the premium tax credits. And then if you're between 250 and 400% of the federal poverty level, you just have access to the premium tax credits. Now, if you're in a state that didn't expand Medicaid, you lose access to that Medicaid option and the cost sharing subsidies drop down to 100%. But that's not as useful because it's the premium tax credits that actually help you buy the plan. So generally speaking, if you have a household of 4 making up to $106,000 a year, your family is getting access to some type of financial assistance to buy a plan in the marketplace. Now, with the American Rescue Plan Act that passed last year, which was a COVID-related bill, it actually added some financial assistance to the marketplace. So for individuals between 138 and 150% of the federal poverty level, you can find a plan in the marketplace for $10 or less per month, which is pretty significant. I think most people don't realize that they might be eligible for this type of assistance to get health insurance coverage. And so we want to spread the word. Now, they also added some financial assistance at the top of the spectrum, where if a family has a household income over 400%, but the cost to buy health insurance for the family would be more than 8.5% of the household income, they can get financial assistance to drop it down to 8.5%. With the American Rescue Plan Act, that assistance was supposed to end December of this year, but with the Inflation Reduction Act, it will now actually continue through 2025. So for people buying a plan in the marketplace, this financial assistance will actually continue through 2025. Now, I want to walk you through an exercise on how to actually compare your health insurance options. And this is relevant if you're comparing marketplace plans, if your employer gives you more than one option, if you want to compare your employer plan to a marketplace plan, or if you want to compare Medicare Advantage plans, this exercise can be used. So here are 3 plans. There's a bronze plan at $200 a month with an $8,000 out-of-pocket maximum, a silver plan at $275 a month with a $6,000 out-of-pocket maximum, and a platinum level plan at $400 a month with a $2,000 out-of-pocket maximum. So assuming that you're going to hit your out-of-pocket maximum during the year, because when we're talking about the cost of cancer care, the likelihood of that is pretty high. Can you tell just by looking at these plans how much it's actually going to cost you for the year? And the answer is no. You can't tell just by looking at them. You actually have to do the math. And the way that you do the math is you take the monthly premium and you multiply it by 12, because that's how much it's going to cost you to have the plan for the year. And then you add that to the out-of-pocket maximum. So when you do that for these 3 plans, it turns out the platinum level plan actually ends up saving you a couple $1,000s by the end of the year. Even though we get sticker shock when we see that the platinum plan is $400 a month, because people don't know how out-of-pocket maximums work, they often pick plans just based on the monthly premium. And they end up spending a whole lot more by the end of the year on those out-of-pocket costs. So when we talk about how do we avoid financial toxicity, this is actually a primary way that we can do that and save people thousands of dollars by the end of the year. But it isn't just about cost. You have to make sure that any plan that you're looking at actually covers your providers and your prescription drugs. Otherwise, the plan isn't going to be very useful to you. So at Triage Cancer, we actually have a number of resources to help people pick their health insurance plans, including an animated video. But we also have a worksheet to help people do the math and compare the health insurance plans that are available to them. And we have that for private insurance as well as for Medicare. So we have a specific Medicare worksheet. Now, I want to talk for just a minute about managing medical bills. Generally speaking, we don't recommend this strategy for dealing with medical bills. We want people to open their mail or open their email and actually take a look at their medical bills. And unfortunately, that mail can include a lot of communications. So it might be a letter from your insurance company that says we've received a claim, or it might be a letter that says we're processing your claim. And then ultimately, you're supposed to receive an explanation of benefits from your insurance company, explaining how they handled your claim. And so it generally looks something like this, but the key language on the explanation of benefits is that it says this is not a bill. So you don't ever want to try to pay your explanation of benefits. This is just an explanation of the claim that your provider submitted to the insurance company and how the insurance company handled it, how much they paid, and how much you're responsible for paying. And then the last communication is actually from your provider. It's the bill. The problem is that these letters and communications don't always happen in order, and you might get the bill first. So it's a good idea to wait for your explanation of benefits before you pay any bills to make sure that they actually match up and that you've seen how your insurance company is going to handle that bill. Because sometimes the providers are too quick and they send you the bill before they've actually received payment from the insurance company, which might look like you have to pay more than you actually need to. So it's always a good idea to actually keep track of all of this paper and make sure that the paper matches up, because you're going to want to make sure that your bills are actually correct, that your EOBs are correct, and that they match. And you can always ask for help from your providers and your insurance company if you have questions about your bills or EOBs. If it turns out that your insurance company has denied coverage for a particular service that you've received, you can appeal that denial. And generally, there's the internal level of appeals where you go back to your insurance company and you ask them to reconsider. But if they still deny coverage and you have private insurance, either an individual plan or an employer-sponsored plan, you now have access to an external appeals process where you get to go outside the insurance company to an independent entity that is going to take a look at your care that's been prescribed by your healthcare team and decide if it's medically necessary. And if they decide that it is medically necessary, that decision is binding on your insurance company, and your insurance company has to cover that care. Now, about 50% of the time, on average, people are successful when they go through the external appeals process, which is pretty significant. Unfortunately, most people take no for an answer. So this is data from 2020, just with respect to marketplace plans. And 42 million claims were denied, but only 0.1% of those denials were appealed. So that means 99.9% of people took no for an answer and didn't even appeal through the internal appeals process, let alone get to the external appeals process. So what this basically means is that about 50% of those 42 million claims may have been overturned at the external appeals process. So that means about 20 million people either didn't get the care that was prescribed to them by their healthcare team, or they paid for it out of pocket when it's likely that their insurance company should have paid for that care. So again, when we're talking about financial toxicity and understanding how to use your insurance effectively, this is also a contributing factor where insurance companies are denying coverage and people are paying for that care out of pocket instead of going through the appeals process. We do have a lot of resources to help people navigate appeals, including our cancer finances module, where the first question is, what type of insurance do you have? And then it directs you to the step-by-step appeals process based on the type of insurance that you have. I do also want to mention surprise billing. So surprise billing is when you know that you have to have surgery and you pick a surgeon and you pick a hospital that actually is in network. The surgeon is in network for your insurance, and you go and you have surgery. And then you get home and you get a surprise bill because it turns out that the anesthesiologist who participated in your surgery turns out to be out of network. Now, this is actually something that comes up quite often in the context of a cancer diagnosis where patients are facing these surprise bills, where they thought they were going to in-network providers, but it turns out someone on the healthcare team turned out to be out of network. There is now a federal law that went into effect January 1st of this year called the No Surprises Act, which actually requires insurance companies to treat those out-of-network providers as if they're in-network and lowering the out-of-pocket costs that patients have to pay for those out-of-network providers. So this is a huge step in the right direction to lowering those bills for patients. Unfortunately, just because we have the law doesn't mean that patients aren't going to face surprise bills anymore. And so if you do come across a surprise bill, there is now a No Surprises help desk where you can actually call an 800 number and get help resolving your bill. You can also do this online at cms.gov. Now, all these medical records and all of this paper is very important for you to keep track of because all of the out-of-pocket costs that you pay along the way, as well as other things like travel to medical care and dental care for that matter, can be added up and may be tax deductible. So it may actually lower what you owe in your taxes or may increase what you receive in a tax refund. So it's a good idea to keep track of all of this information because it may actually end up saving you money. To help you do that, at Triage Cancer, we have a new medical bill tracker worksheet. And this is a worksheet that you can download from our website for free. And this is just a blown up section of the top of that worksheet. And you can use this worksheet to add in your plan name, the deductible amount for your plan, and the out-of-pocket maximum for your plan. And as you receive bills throughout the year and you pay those bills, you can add those in at the bottom. And it has the formulas in it to help you keep track of how much you still have to pay to meet your deductible and whether or not you met your out-of-pocket maximum for the year. So it helps you keep track of this information in one place. It's just one more tool that's available to help you do that. Now, the three major credit bureaus announced in March of this year that they're going to treat medical debt differently on those credit reports. And that's pretty significant because even small amounts of debt on your credit reports can have a big impact on your credit score and make it more expensive for you to rent an apartment, to get cable, to buy a home. So your credit score can actually have an impact on what you pay for those other things. So effective July 1st of this year, paid medical debt will no longer be included on credit reports. So if it showed up as a collection on your report, even though you paid it, that will now go away. And the time period before a debt gets added to your credit report will be increased from 6 months to a year. And then starting next year, they won't put medical collection debt under $500 on your credit report moving forward. So these are all things that are going to be helpful to consumers. So when we're talking about managing medical bills and addressing the financial burden of a cancer diagnosis, there's still going to be costs that you need to pay. And so you might be able to get help paying those costs. And we want people to think as creatively as possible about the financial assistance that might be available to them. Because sometimes people will say, well, I need help paying my medical bills. And they only look for help with medical bills. But if they can find assistance for their utilities and use that money to pay their medical bills, then that can free up some of those bills. So think broadly and creatively about financial assistance. And at Triage Cancer, on the Cancer Finances tool, we have an entire module on financial assistance, which has all types of programs broken down by category that might be available to help people. We also have a whole module just for prescription drug assistance programs that includes pharmaceutical companies that provide assistance by drug and the contact information for those programs. And then we do also have a drug discount card in partnership with Needy Meds. And this drug discount card is something that you could use instead of your insurance when you go to the pharmacy to pick up a prescription. So if, for example, you go to the pharmacy and you find out that your copayment is $300 and that's too expensive for you, you can ask the pharmacist, can I use this drug discount card instead? And it might actually lower what you have to pay for that copayment. Now you're using the drug discount card instead of your insurance. They might also say, well, we don't take this drug discount card, but we have this other program that might qualify. The point is to remind yourself by using this card to ask the question. Because if you don't ask the pharmacist the question, is there a way to lower my copayment? They're not generally going to offer up that information. So this is a card that you can print out from our website. You don't have to register for it. It's not specific to you. You can use it for the whole family. You can hand it to a neighbor. So this is just a good tool to remember to ask the question, can I lower my out-of-pocket costs? So with that, I'm going to stop and